We begin tonight with a dispute that's threatening to undermine Queensland's public hospitals. Senior doctors are continuing to warn of mass resignations over new contracts. The Minister says they're being misled by interstate unionists. In the midst of it all, the AMA is calling for calm. But the situation is on a knife edge, with doctors at 2 regional hospitals telling 7:30 Queensland that entire departments are set to leave. Kathy McLeish reports.
Temperatures have been rising in the debate that's raged since January between the government and Queensland's doctors over contracts.
What else is there to actually give?
6.5 pages of industrial demands of stuff on pay and conditions and meal breaks and allowances, but only one mention of patients.
We're not foolish, we're not hysterical, but we're fed up and we want to go back to being doctors. Let us go back to being doctors. Stop us doing.
But this week, with a deadline looming, there were moves to turn down the heat. The Health Minister agreed to reduce the 3-month resignation notice period to 2 months before doctors lose entitlements, to allow them time to consider the latest deal.
There is a significant loss of trust at the moment, and taking some of the pressure out of this exercise is a very important thing.
Yeah, I've already resigned, handed in my resignation yesterday.
Dr Mark Scott says it's too late.
Even if they take the changes they've started to make it last and make them valid, it won't change the fact that the attitude portrayed by the Minister for Health and, as a result, the Executive is still very adversarial to their doctors.
The staff specialist at the Caboolture Hospital Emergency Department says if there's no resolution, he won't be alone.
The vast majority of consultants in the emergency department are joining the mass resignation campaign and signing documents and sending them into the union.
Just hours earlier, doctors had predicted the move to close Caboolture's emergency ward because of a chronic doctor shortage.
In 2006, at the height of the Queensland health crisis, Dr Scott was the only doctor left when the Caboolture Emergency Department closed due to a doctor shortage. A medical consultancy company was brought in.
It cost them $7.8 million to keep the doors open for 1 year for one department. It took 2 years to recover, 2 years to stabilise the emergency department. How long would it take to get Queensland back and running?
Dr Michael Bint is the Director of Respiratory Medicine at Nambour Hospital. He left private practice to help establish the service 4 years ago.
Well, after much soul-searching, my department of only 4, not a big department, my department of 4 has decided that we can't go on with these contracts.
He and other senior clinicians from Nambour Hospital have made the decision to speak out. They say 4 medical departments, respiratory medicine, orthopaedics, cardiology and anaesthetics, could close.
1 July 2014, there will not be an orthopaedic department in Nambour General unless there are contingencies in place.
About 80% of the department say they're submitting a resignation.
90% of the department, and I'm with them, feel that they need to mass resign. So that's the desperately sad situation.
The standoff has hinged on access to the Queensland Industrial Relations Commission for unfair dismissal, security of contracts and negotiations over performance targets or KPIs.
The problem with this is that these KPIs are being put in place in the contract as they are, but they can be changed at any time after this contract's been signed. So I'm quite happy to have goalposts to work towards, but I'm not happy for those goalposts to be continually moved. I don't really want to resign, but I also can't continue to work if I don't have ability to manage my patients to best practice.
Managers can step in, potentially, and say you cannot use what you want to use, even though I think that's the best interest of the patient.
After a series of protest meetings, the Minister returned to the table and offered an addendum to the contract. The doctors say it's a missed opportunity.
The Minister wrote me, and I'm sure many doctors, a letter explaining that he would change the Hospital and Health Boards Act, which I have to say I was so pleased to hear. But unfortunately, at the end of the sentence, He said, unless a regulation provides otherwise. And I have to say, I could have put my head in my hands and cried over that, because unfortunately that then leaves the whole thing open again.
At the Doctors' Union office in Sydney, a rising number of resignations sit, ready for release if there's no resolution. The Minister says the doctors would be happy to sign if they knew the facts without union interference.
We can understand complicated information. We can understand different legal opinions, whether they're from government side, whether they're from union side, or whether they're completely independent opinions, as many of us have sought.
I think the mass resignation is a very likely option, unfortunately. I really hope that the Minister is thinking about how we can avoid this lose-lose situation.
If we don't do this, the patients suffer. It's terrible. It's truly terrible.